Go. Okay, takes a minute for it to go up. Now we're live. So we're live?
Okay. We do have a quorum, even if Mark can't hear anything. We should probably call the meeting to order. What do you guys think? Maybe I see.
Elaine, I'm here now.
Oh, good. That's you, Mark?
No, this is Tim.
Oh, hi, Tim. Tim called in. We're having trouble having Mark call in, I guess.
Okay.
But
I mean, we got a quorum?
we do, Mark's there, but he can't hear anything. But we do have a quorum. So
Okay.
I guess we'll get started.
Go ahead and roll it, Chairman.
Okay, your call. I'd like to call the Health and Human Services meeting to order tonight. We have minutes of March 8th to approve.
Bowling.
Can I get a second?
Second, Lattimore.
Okay. Any changes? We're all in favor?
Aye.
Okay. We do have one appointment tonight, which is to the Community Services Board. That information was part of your packet. Can we get a motion for that appointment?
I'll move the appointment.
Okay. Anyone will second?
Second.
Okay. All right, great. Thank you. We do have tonight 7 resolutions. I don't think there's too much crazy on the agenda tonight, but if we want to start with the Office for the Aging, you have the information that Brenda provided, talks about the vaccine, the Johnson & Johnson vaccine clinic that was done in combination with Kinney Drugs and her Meals on Wheels program, and some issues around her aid service that as part of her report. If Brenda, do you want to add anything on your report or answer any questions that anyone might have before we get to your 2 resolutions?
Madam Chair,
Yep.
just a point of order that we have to allow for discussion and have a vote on the appointments that we missed.
I thought I did move it and there was a second. Okay, I guess any discussion on the appointment of Teresa Hominy? Okay. I thought we did get a motion. Everyone was in favor of the Community Services Board appointment.
We didn't vote on it. You just have to say all in favor.
Okay. All in favor?
Aye.
Aye.
Okay, thank you.
Elaine, you went on mute.
Anything you want to add to your information?
Yes, thank you. I wanted to just mention that, I'm sorry, lost my train of thought with all that. I wanted to mention that we are, in addition to what's listed there, in the process of signing up so many seniors for the vaccine clinic. We have been able to identify a number of homebound individuals who are still looking for a way of getting the vaccine. And I've been in touch with, I just talked with Marcy in our health department. She reached out to me today. We've also been in touch with East Hill, who had hoped to be able to do some homebound. And most recently, Nescentia out of Syracuse area reached out to us and offered to help with some of the homebound vaccines. So I may have mentioned this at a previous meeting, but what we're finding is as we vaccinate more and more seniors, the hardest to serve are starting to surface as those that still are in need. And I know various entities are really trying to come together to try to meet that need. So I just wanted to update that. We had such a great success out at Red Creek and partnering with the Wayne County Department of Aging and Youth and all the different entities that were involved. It was really a really amazing event in that we only had 2 very short meetings before the event. Everybody just took their piece and ran with it for a full, long day, but very successful, and everybody did their part. So very pleased and hope that we can do more future programming up in that area at the combined effort with the 2 counties. Really worked out well. And then the other thing I just wanted to mention is in regards to the third bullet point about our PCA, that's our hands-on aids that provide care for those greatest in need, those that are most at risk of going into placement at a nursing home or some other facility. Those are the individuals we're having trouble finding aids for. And this isn't new. This has been going on for a few years now, many years, but it's really gotten to the point where it's almost impossible for us to get those aids to meet that need. And one of the positive things that came out since I wrote this report is I had a phone call with the New York State Office for the Aging Director, and he has indicated that there are funds available, because I reached out to him, that if we're able to look at some innovative options, he will make those funds available to us in our county. So that was really exciting news. I just got that on Friday. So I just wanted to mention that as well. Does anybody have any questions about anything?
Brenda, I have a few. So my first one is your report that your Meals on Wheels program has seen a 9% increase, and you're able to extend the routes and triple the number of volunteer drivers. I think in past years, we've had issues trying to find volunteer drivers. And so maybe what is changed this year in terms of those drivers being available? And then is the number of routes flexible in terms of, can you reduce that if need be? And so that's kind of my first part of my question. The second part is, you mentioned that you're starting to see hard to reach population, the older populations is starting to come to the surface in terms of vaccinations. Where are you seeing that population come from, and what are some of the difficulties that they are facing?
Great questions. Thank you. I love questions. So to answer your first question, about 3 years ago, I came to the legislature and said that in order to get enough volunteers, we need to designate a staff person solely in the role of volunteer coordinator. And you all approved that. We got a part-time volunteer coordinator position, which we have never had in the past. And that has more than paid for itself, because over the 3 years since that position was approved, we have now successfully gotten this huge number of volunteers. Staff almost never, ever, I don't think they went out at all last year to deliver meals, which 3 years ago staff were delivering all the time. So it's been a huge success, and a big part of that goes to the current volunteer coordinator, Kim Dungy, who is just a perfect fit for that role and has done a phenomenal job. So I'm really happy to report on that. That was very strategic, use of our funding to create that position, and it has just paid off so well. It's very happy about that. You asked about the flexibility in responding to the route needs and the increases. That's a little bit tricky, because as the program continues to grow, we only have, in addition to Kim, 2 full-time staff to run that whole program. So as the number of people grow, I don't think that people realize that New York State Office for the Aging, in exchange for giving us that money, requires that every individual have a home visit, everybody on the program have an extensive assessment and care plan related to that. Often involves some referrals to other staff within the agency, maybe for health insurance or some other program needs, maybe to the dietitian. So we have one person doing up to 500 individual assessments a year right now. That is not sustainable. That is really going to burn that person out. So as this program continues to grow, I'm concerned about additional staffing needs in that program. We're okay at the moment, but as this continues, I'm concerned about that. So we know that the federal government is sending us an additional $37,000 in funding for that program. But, and we've had the extra COVID related funding that we've been able to use in that program both this year, and that's helping us hopefully into next year, maybe a bit. But ongoing, we're going to have to see what happens. The pandemic has really shown a light on those folks who are home and were particularly at risk during the pandemic. But that's also a component of the just increasing population we saw prior to the pandemic, that we knew the older population is growing, is the fastest growing part of the population. So we can anticipate that need for Meals on Wheels is going to continue to grow. Your second question about the hardest to serve individuals, our experience on our call line related to this, they're all over the county. Some are very rural, some are right in the city. They're homebound typically due to physical disabilities. But we also saw a component of folks who had some mental health issues related to being able to kind of put it together and be able to access the kind of options that are available right now for the vaccines due to transportation issues and just due to some comfort levels and such. So that's been our experience with the call line. I'm sure the health department and others have even more to add to that. Does that answer your questions? I'm sorry, Elaine, you're on mute.
Oh, sorry. You mentioned that Essentia and other certified home health agencies might be stepping up to help reach the essentially homebound. Are they offering that as a community service to patients that aren't open to them, or how will that work?
Yeah, originally we had heard it was only for their own patients. It did show up in the Syracuse News that they were going to be serving patients throughout Onondaga County. And then I don't know exactly how it came about, but one of our New York Connects workers, Mike Case, was in conversation with one of the staff from Essentia, and she offered their services to our clients out here, or people in general, not just our clients and not just their clients. So the community in general. It was a small number though, Elaine, so we're not really sure what impact it'll have, but it's a good start.
Thank you.
Yeah.
Madam Chair,
Yes, Tim.
I've mentioned that right now there's a golden opportunity with the funding that's in the program. I see that downstate has gotten a lot for transportation money, and I'm just wondering whether or not I've mentioned that we should get some grant writers and see what's available. Maybe get some new scat bands through grants, and maybe because we're the subway system and all the other transportation that's down in New York City, it's all funded. Hopefully Gillibrand or one of our other representatives upstate can try to get a piece of that money for situations where we're dealing with outbound or homebound personnel. But Brenda, the exposure rate that our homebound people have, because they're isolated, I mean, the infection rate, is it high, low? Do we know how we stand with our homebound people?
I'm not the best one to speak to that, but I can tell you that the folks that are homebound often have some significant needs, which means they may have some staff coming in from agencies to provide some hands-on care. So they're not as isolated as you might think, and they also are some of our at most risk individuals.
Oh yeah, absolutely.
I will mention that most of them that we were able to identify truly are homebound, because the SCAT van is already doing a significant job and service to the community, bringing people to the vaccine clinics. They brought 5 or 6 people to the clinic up in Red Creek, and I know they brought people to the clinic in Auburn and others right along. They've been doing a wonderful job. So anybody who's able to get out, even in a wheelchair, the SCAT van can assist. But these are folks that it's actually very challenging for them to get out, even in a wheelchair, that are homebound and are harder to serve.
But it would be nice if we could upgrade that fleet. It's aging, and you know, to help them out, and they do a tremendous job for the county. We should be able to get them some grant writing ability so that we can maybe put together some grants so we can go after them with this money that's available.
That sounds great. That sounds great. Yeah. I know, you know, we do provide some funding for them, but they always need more. Yeah.
Yeah, absolutely. Thank you, Brenda.
Thank you.
Any other questions for Brenda?
I have just a follow-up question on the personal care aid shortage, Brenda. And you mentioned the state has potential funding for innovative solutions for our county. Do you know how much funding approximately? And are there any solutions you guys are looking at currently?
It's a little early in the game right now to get into the details too much, but just a variety of different options I'm looking at, and reaching out to other possible agencies that might be able to have some kind of enhanced contract with us, some kind of guarantee that, you know, a certain amount of hours could be devoted to our clients, all the way to, you know, looking at would it make sense at some point to look at you know, somebody working for the county as an aide. We're kind of looking at the whole gamut, what's sustainable, what's most cost effective, what's actually possible. It's a really challenging aid shortage right now, and there isn't a one size fits all solution. So I'm going to look at all the different options and see what makes the most sense for our county.
And the training and certification for that PCA2, is that offered like at BOCES currently? Do you know how long of a training that is to become that, to get that certification?
So I don't really actually know all the details at the moment. It's not as involved as an aide, like a home health aide. It's not a PCA2 aide is a non-medical level of care. And that's why Office for the Agings are actually able to hire a PCA2 and oversee a PCA2 level of service. But it's similar training, but it's not as great a training as like a home health aide. But yes, it's available. Good questions. Thanks.
Thanks. I'll just comment that I know this is a huge issue in our community. My family had this issue with my grandmother, and it continues to be an issue, especially with our aging population. So
Absolutely.
I'm glad to hear there's some opportunities there for funding and creativity.
Absolutely. Yeah. And again, even more so in the rural areas. So our hardest to reach, our hardest to serve are particularly impacted by this. And Elaine knows we've gone the route of trying to promote the concept of consumer directed aids, where an informal caregiver is paid to provide aid care. And we are finding even that is just a challenge because our program's somewhat unique. It's typically 4 to 6 hours of aid service a week. It's not enough for one person to take care of one other person and make a living at it. It's really, it's just there's a lot to it, a lot of different aspects to it. So before I go off, I just want to give a quick shout out to Mark Strong, even if he can't talk with us, because he did stop by and take a quick tour of our office today, just impromptu. So I just want to mention that and thank him for that.
Great. Okay.
Thanks.
If we, no other questions, maybe we could go and talk about the first resolution authorizing to fill, I believe it's either a principal account clerk or a principal account clerk typist in the Office for the Aging in response to a resignation. Could I get a motion for that, and then we can discuss it if need be?
Foley.
A second?
Sure.
Okay. If there's any discussion about this, I know a month ago we talked about giving you authorization to do a temporary fill. but this is the same position that you were not able to temporarily fill, but in the interim, the incumbent submitted a letter of resignation. So now this would be the ability to fill the budgeted vacancy in your department.
Correct, yes.
Okay. There are questions for Brenda? If not, could I get a motion, or could we get a vote on this? All in favor?
Aye.
Okay, any opposed? Great.
You're muted.
HH2 is to contract for services to produce and mail the quarterly senior news and views newsletter. That's something in your budget, and I'd like to get a motion to move HH2 if I could.
Move it, Foley.
Second. Okay. Any questions for Brenda about this?
I just had one quick one. Does this newsletter get posted on our website currently?
It does.
Okay.
And do you get it by email? Because all the legislators should get it by email.
Yeah, I'll have to look because I'm not sure if I get this specifically. Yeah.
Okay, all right, I'll double check our list too. Okay, thanks. Mhm.
Any other questions? All right, all in favor?
Aye.
Okay, opposed? Great, carried.
Thank you.
Okay, and if we could go on to the health department. I don't see an update from Kathleen, but she'll usually have something to tell us, but maybe we could do your resolution first, Kathleen.
Sure.
Authorize the county to enter into an agreement with New York State to participate in the Drinking Water Enhancement Program grant, which is a grant you've been getting for a while, and accept the funds that offset some of the costs for your personnel. Can we get a motion for HH3?
I'll move it. Her.
We have a question from Heidi.
Yeah, is there any questions? Well, I
I'll
need a
second.
motion in a second, and then we can get to questions if there are any. Would someone second HH3?
I'll second it, Elaine.
Okay. All right. Are there any questions about this? Okay. Hearing none. All in favor?
Aye.
Aye.
Okay. No one appears to be opposed. Thank you. Kathleen, do you have any updates you want to talk to us about?
I do. And I know one of these days I'll get it together so that I can send you something in writing ahead of time, but poor Amanda, I'm like, oh, I should have some data. I'll get that out, but yeah, it didn't happen. So let's talk the big topic, COVID, because, what would the health department be without that right now? We have 129 people in isolation. It's a lot. Our numbers are going up. We're definitely seeing it in the unvaccinated population, which until recently was 20 and 30-year-olds, certainly in school agers as well. We're seeing what is called breakthrough cases where someone's been vaccinated, but they test positive. Now, the good news in that is that the vaccine's working. And people might say, oh, how can that be if you tested positive? We're identifying these people because they're going for medical procedures and they're being tested as part of their hospitalization. They did not go into the hospital because of COVID. They are not sick with severe symptoms. They are not dying from severe symptoms. So the vaccine's doing exactly what it's supposed to do, which is reduce severe illness and death. That's wonderful. It's also supposed to diminish the spread of the virus. So we're pleased that that should be working also. So now we really have to put a push on for people who aren't getting vaccinated, right? Well, if they were hesitant, we've got to focus on why they are and try to educate and provide some outreach, because if we see increases, particularly amongst the school agers, that's going to impact the options that they have to do things. And we know that the schools want to open up further. We know that they want to be able to have special functions. They want to have gatherings, and they've got to have people not be positive, so that can happen, right? I'll speak a little bit to the homebound that Brenda was speaking about, and what a great cooperative the offices for the aging did between Cayuga County. I know Brenda spent a long time. I'm more familiar with what we did in Cayuga County only from speaking with her. But right along, our local OFA has really been gathering up names and data and trying to get people linked into clinics wherever they may be, which is the point. And that's something we want to encourage people also. You don't have to, we love to serve you here at the health department, but if you can get your shot at the pharmacy, if you can get your shot at federally qualifying healthcare center, if you are going to the state fairgrounds, do it. The 16 and 17-year-olds have to go to the state fairgrounds because that's where Pfizer's being offered right now. Let's find a way to help get you there. Transportation, we're addressing that. The SCAT van's excellent. At our clinics at the Finger Lakes Mall, the Central Bus will take people at no charge. If you're eligible for Medicaid medical transportation, can take you in the Medicaid medical transportation. But we're trying to be creative and working. I know like Trish is on a group that we've met a few times and spoken to try and maybe get faith-based community groups engaged. Perhaps there are ways people in their congregations, they can work with volunteers to help transport people. We're not in love with bringing people together who, if they haven't been vaccinated, but there are ways you can limit the exposures with preventive activities. We have to continue to push the preventive activities. Wear your face cover, wash your hands, stay home when you don't feel well. It's allergy season again, and people are showing up at school or showing up at work with, oh, I just thought it was a sinus headache. No, it's COVID. So you need people to be careful. We are continuing to do testing. We're going to be moving the site. The emergency management office has just done a phenomenal job in maintaining asymptomatic testing for our community. The hospital and the urgent care centers perform it as well, but our emergency management office has held some routinely scheduled clinics, and they'll be continuing that. As they leave the pavilion, they'll be going out to the Finger Lakes Mall also at the same site where we are currently offering testing at different days. So that's going to be available, or excuse me, at the same site where we currently offer vaccination. One of the things I wanted to share with you, we talked about outreach, and I have to put on my glasses because the print's really small here, but I got an update today that offered some good data broken down by zip code and the 65 plus age group. We're doing a really good job as a county in reaching some of our, I won't say harder to reach populations, really more our more vulnerable populations, right? So the news that I was so pleased to read was that where we scored as a county, and I know it's not a competition, but it's nice to see some evidence of the good job we're doing. For people who score high on the social vulnerability index. Now, the social vulnerability index, for those of you who aren't familiar with that term, it is people who may live in poverty, may not be employed, may not have high school diplomas. Perhaps they have a minority status that impacts their well-being, language barriers, disabilities, things like that. We're number 4 in the state for reaching people, and that's out of 62 counties. So they counted the 5 New York City boroughs. It's at 44.5%. What does that mean? We want to get as high as we can, right? But I was really pleased to see how very well we scored there. With our 65 plus population and our total population of 16 and older who are eligible, we're right smack in the middle. So I expect we'll continue to move up the ranks there, hopefully. We did have some of the data for 65 plus. There's no question that our Office for the Aging and our towns and village and city have made a tremendous beneficial impact in helping us reach this population who are mobile. We're doing really great. Where the lowest percentages are Martville, Sterling, Moravia, Meridian. of the zip code breakdown that we have. So that's going to help us in trying to target those areas a little bit more. I have not shared this data with our towns and villages yet, but I will be sharing that with them. And with the city as well. So that's really, I'm pleased. That's really going well. Homebound home care agencies certainly are a great way to provide the service. I was so pleased to hear Marcy was sharing with me a conversation she had with Brenda that Nescentia is able to do this. We haven't really connected formally with our home care agencies yet. I fully admit that we're focused on the big groups right now and the mobile populations, to the point that Tim Lattimore was making. To a certain degree, our homebound population is somewhat insulated. But we know there's caregivers, so we work on the people who surround these homebound people right now. If you're a caregiver, get your shot. Protect yourself, protect the people that you're caring for. And we're going to find ways to get that to you. Aside from home care agencies, health departments, if you have an RN, it's the New York regulations, which is inhibiting some other agencies from being able to go out and provide this service as readily in a homebound situation. And that's for a reason, right? That's why you see there's all sorts of regulations, which is why you see doctors at our clinics. That's why you see RNs give shots when they're out and about. But we just received communication over the weekend from the state police. They have created a team of people that are community paramedicine team, and that meets the criteria that the state health department has identified as an acceptable alternative to a nurse, an RN, performing a homebound vaccination. So we'll be having conversations with that regional team to how we might work better together. And the fact that OFA has a list of names, we have a list of names. We have not forgotten our homebound population. We're just trying to identify the best manner in which to convey this vaccine to you. And it will happen. It's taking longer than some people want, but it is moving forward, which is the good news.
Yeah, you did. If I missed this, I apologize, but you told me that, you thought us reaching the vulnerable population had a lot to do with the cooperation of the towns and villages. Is that your sense, of this? How essential or how well thought out that strategy was to get people in the rural parts of this community?
There is no question that was a huge, huge factor in us doing as well as we have. Having the town and village clerks, the Office for the Aging, the city literally help register people who would not have had access online otherwise, or would have had hesitancy, or identifying what their transportation barrier might be, absolutely made a humongous difference in us achieving this status. And we're continuing it. It's not, although I will say, I was really impressed, and Fairhaven has 100% of their population 65 and older, according to this chart, who received their vaccine. So
great.
Kudos to them. Gold star to Fairhaven on that one. So the work continues, and it will. We'll keep moving forward on the vaccination side of things, the testing side of things. A lot of guidance still coming out. This pertains to a lot of our community businesses and our schools. We just got some new school guidance Friday night. Information about proms and graduations just came out from the state. The mass gatherings, the arts, we know that, there's music and there's theater that people want to perform and have. So there's a new guidance that came out last week on some of that. So all of these entities are learning to work within the parameters, the safety parameters that we're trying to enact. So we're pleased that at least there's some, it really seems like a common sense approach to trying to keep your distance, get your test. And one of the neat things that's available, they talk about the Excelsior Pass. If you have been fully vaccinated, if you're someone who uses a smartphone, that's kind of a neat thing. It's an app you can download that shows that you've had both your vaccinations. So that's to your advantage as these events start to open up. That may be a requirement. The colleges, a lot of you are reading, there's requirements for many colleges, particularly the private schools right now, that have announced that vaccination is going to be a requirement for their students on campus. So that will continue, but we're really pleased. We're pleased also, there was a real, as many of you read, Johnson & Johnson had the 15 million doses that had to be wasted due to quality problems. And right, we don't want something that's not meeting the requirement. There's a real convenience to the one dose. Right? And we had made a request a couple weeks ago to have some Johnson & Johnson to reach some of our special population groups that really would benefit better from one shot. Whatever type of vaccine you can get is great. Moderna, Pfizer, J&J, they're all great. They all serve the same purpose. They all have excellent outcomes. We were able to get some last week of the J&J. We went to our county jail and could vaccinate jail inmates there as well, who live in congregate setting, and some of the personnel who are there. We're also going to be working with our farm workers this week. We were really fortunate due to our communications and laying the groundwork that we've been allocated some J&J to provide some farm worker vaccinations. So I think that's really going to help on, again, these special populations that where we need to reach, and we're able to get a wider group of them. This is the same type of vaccine that we're going to try to use for our homebound population as well. So we're hoping as we move on, and we want to get this for our college students too, because if we can get them their shots, they're going to be leaving, right? The school's going to be out in a few weeks. So if that's an ideal vaccine for them to have, so that they are fully vaccinated before the school session ends.
Okay. And any other questions for Kathleen? Great. Thanks a lot, Kathleen. Okay. Ray? Oh, hi, Ray. Good. You have 4 resolutions tonight, and you have quite a bit on your update for us. So we can get through the resolutions if you want, and then we can go on to discussing any of the points you want or answering any questions.
Sure.
I suggest we go through HH 4, 5, and 6, and then, offer them up for a motion, all 3 of them. They're all contract renewals within the department. So HH 4 obviously is a contract with Community Action Program for the provision of non-residential domestic violence services. That's a contract that you're required, that you've had for a while, and there is a responsibility for the department to meet those needs.
Yep.
HH 5 is to renew a lease agreement with Pitney Bowes for the mail equipment located in the Department of Social Services Accounting Division. I believe that's an ongoing contract. A decision was made a while ago that would be certainly cost effective in terms of having access to that instead of having staff be, traveling all over the place for the amount of mail that you have. And HH 6 is to renew a contract with the Rescue Mission for the homeless family and transitional housing. That's a contract you've had for a while as well. So if I could get a motion to move HH 4, 5, and 6, and then we can open it up to questions and then a vote.
Make a motion, this is Kerr.
Okay, could you, a second? Anyone want to second that? Okay, Heidi. Is there any questions about HH 4, 5, and 6?
Yeah, but I'm done with that by 11.
Elaine, I have a couple of questions.
Okay, go ahead, Ryan.
Did we say noon, 9 at noon?
Can everyone hear me? I know we're getting some feedback and On HH4, can we just get a quick rundown on what the term non-residential domestic violence services are, like what that actually is? I'm just curious about it. Seems interesting. And then HHS5, the Pitney Bowes machine. I know that the Board of Elections purchased one, I think last year, with some extra funds that they had or asked us to provide, I think in partnership. And because they had a wide assortment of mail too. I don't know how they have to really use theirs when election time comes around, because they have so much mail that has to get sent out. But maybe there's off times when they're down a little bit, where our staff can utilize that. I don't know if that would work. I'm just trying to find a collaborative effort there. Both departments are using the same product. One's leasing, the other one's purchased. That's all. So yeah, that's a couple of the questions I had.
Okay, so the non-residential domestic violence is the domestic violence hotline. And then the staff that respond to work with individuals that call. So they accompany them to court. They help them find services. They give them counsel and advice and provide the necessary sort of support that folks need, as opposed to residential services, which is the shelter. So that's the difference. It's a mandated service that departments of social services are required to provide. The Pitney Bowes thing, we mail a lot of letters and a lot of checks every day. So I'm not sure that there's an opportunity there to use that, because it would really need to be housed in the department, get quite a bit of business out of it. But I'm happy to check in with Grace for you and let you know before Ways and Means.
Yeah, I mean, it's not like a huge thing. It's just, it seems like a really good machine to have. And if we have two departments that utilize that much mail, maybe there's opportunities there, maybe there's not, that's all.
I'll check with Grace.
And Ryan, this is Elaine. Did you say that you think they bought it, or they also lease from Pitney Bowes?
Boy, I want to say that they purchased it.
Well, there's other options besides Pitney, which is a metered machine where you can change. Like we have something at mental health that's not a Pitney Bowes machine that you can purchase. So there are a couple. So I'll look into all that and let you guys know before Ways.
Okay, that'd be great. So I guess my question is, we'll move these and then we'll get those questions answered. Is that what the committee wants to do?
Yeah, I mean, they're already moved.
Okay. All right. Okay, then, all in favor? Did we get there yet? Okay. Anyone opposed? Okay, great. Thank you. The last resolution is under mental health, and that appears to be the filling of a full-time staff social worker that is vacant due to a resignation. Can we get a motion for HH7 and a second, and then we can answer any questions?
I'll move it.
Second? Okay, Trish? Okay, thank you. Is there any questions about that for Ray?
Can I make a comment?
Certainly.
Yeah, this is unfortunate, because this is a therapist that had worked at a different county clinic and had wanted to come here to work, because of the reputation of the place, and she ended up being able to come here, but has some stuff come up in her life that causes her to have to leave. So hopefully we can, if things work out, she can come back as a contract worker. But we really need, I mean, I'll talk a little bit about this in the report. We're just getting slammed here.
With work, you mean, in terms of patients and?
Yeah.
Yeah.
Ray, are you guys still fully remote now, or are you half and half, back in with your therapist, or, where?
We've been face to face throughout it. It's a mix.
So yeah.
Well, I asked that is because, we had a report from our IT department at government operations that said that they were trying to put in, I think, more wire, upgrade the wiring at, the mental health building because of the increase in traffic and stuff, with all the data, that's flowing through there and all of the services that, video.
Mhm.
So, I just
Really,
didn't know.
the building wasn't equipped with enough capacity to deal with any amount of remote work. So 8x8 meetings. I mean, we're doing probably 34,000 visits a year. So if we do even 1/3 of those remotely, it just completely shuts the building down. So that upgrade's been about 10 months in the making, and we definitely need it.
Okay, great.
All right, did we vote on that? I don't recall. Lacey,
No.
did we vote on that? No? Okay. Any other questions? All in favor? Heidi's gonna put her hand up, I guess. Yep, Trish. All right. Any opposed? All right, great. That concludes the resolutions. You do have some stuff on your update, Ray.
Yeah.
I have a couple questions. I don't know if anyone else does, or you may have, and then you can add anything you want. I guess my first question, I'm, sort of jumping to some conclusions. You talk about contracting with the probation department. I know you talked a little bit about that at the time of the budget, and that perhaps there would be an opportunity, even if Jay stayed as the appointing authority, to have some time of a probation officer to be working with you on these juvenile cases.
Yes.
And I wonder if the reason this has come to light is the second bullet you have about Pinn's case being put into care. I assume that's foster care or detention, or I'm not sure what. You took a Pinn's case in that's 100% reimbursed by the county?
Yep. No,
And-
we're talking right along with the probation department about, this concept starting in the beginning of the year around, using the juvenile probation officer to work on Department of Social Service cases, kids that were like, sort of like warming up for the juvenile justice system, whether Pins or JD, sort of pre-Pins, pre-JD behavior. And so we just have been talking about that and working through the issues, talking to Division of Probation and Corrections, right? Making sure that this is going to, be something that they understand and support. Same with our end on OCFS. And so we've sort of come to the place now where we understand. We have worked with the probation officer as well to, get her comfortable with the idea, because it's a big change. It requires her to be in connections and all of that sort of stuff. So it's really they're not related. It just
Okay.
Or at the same time, it wasn't a reaction to the Pins case. That really didn't have anything to do with the probation department. That case getting placed with the county. That was more about the judge just being, legitimately frustrated with this particular kid who was putting herself in danger, quite often by running away. He just, she was in court and he just, put her in our custody.
I was curious if that case went to court from probation without an opportunity to look at alternatives for the court, but they weren't connected in that way.
No, I think there were alternatives were offered, and I think work was being done with this particular kid, but it's just, I think no matter what you do, I think we just want to do the best we can. You're going to get some of these cases that squeeze out that way. I think that the challenge, the thing for us would be like, no one says the kid has to be in care for 18 months either. Like, we can send a kid home on a trial discharge on a Pins case anytime we want. So, you've been
And that's the oversight on the case that you're going to make sure you have so that it doesn't languish in foster care. Yes.
Right. Otherwise, it'd be an 18-month placement, just because that's what the law allows.
And then my next question, and then we'll, had to do with the OTDA influx of federal and state funds for eviction and rent relief. Is that money coming through to the department that you'll keep or you'll subcontract, or you're not sure yet?
So this is fairly new information. Like, we found out on Wednesday at 5 o'clock that we were going to have these calls sometime in the afternoon on Thursday. So the governor made OTDA hold on to the details until the budget passed. So the budget passed, and this is the money that it was in the last federal legislation package, the Rescue America Plan. I think that's what it's called, or something close to that. There's quite a bit of money. It's a lot of money, and it's got different rules than the other money that we have, which we have a lot of that money as well too. We got another $360,000 in the prevention and rapid rehousing money that has some strings to it that doesn't make it as accessible just yet. But this money, I mean, the way that this is looking right now, so I thought I might have more information from OTDA. They haven't released it yet. They're on it though, and I think they're pulling it together. What they did was they gave the counties a heads up and sort of a sketch. So the heads up was, this money, the OTDA is going to, so the money doesn't come to counties. The money comes to New York State, and it's broken down, New York City, and then, some other places that have population centers, 200,000 or more. They got some of this money before. They're getting more. And then upstate, I'm thinking it's like $58 million off the top of my head, or 500. I don't remember. Like, it was a lot of information, came really quick over the phone, and we were trying to sort out. So there's a chunk of money out there. It's available for the entire upstate region, right? So OTDA is building a portal that people make application into, and the portal, they're looking at this going live. They talking about the middle of May. So what they wanted, and this money, the difference with this money is that it can pay. So there's your average income in counties, is sort of what determines what the cutoff is. So the original pile of money have to be 50% or under. This goes up to 80% or under the average median income in the county. So, and also this money can be used to pay 12 months of arrears, where the other money couldn't pay that much, and can pay 3 months prospective rent, and can also pay utility arrears. So they wanted to tell us all of that, and that's pretty exciting, because I think it opens up. It creates opportunity for people that might otherwise sort of not have had this option. So we're really trying to. I think we set something up for Wednesday morning with the folks that can help us. The counties really have to, because it's going to be like a first come first serve thing. So like the first 30 months of this rollout is going to be for what they call specialty population, which is 50% or less of the average median income. Veterans. What was the other thing? They didn't quite identify what all of the eligible populations were, but so those were a couple of them. So those folks get first crack for the first 30 days, and then it opens up, to the 80%, which is anybody that qualifies. So we have to, counties have to figure out how we're going to push this information out. How are we going to?
Just froze.
He's
All right,
gone.
froze. I'm talking. That's what happens. Elaine, can you still hear us?
I can hear you. I can't. Ray looks frozen though.
It froze up.
Yeah. This has got to be a huge relief to some of the landlords too, that have an opportunity to have, have the monies come available to them to keep these individuals housed as well. So that's great.
He might not know that someone wants to text him.
Okay. I can, I will.
I got it. I got it, Elaine.
Thanks, Jody.
Elaine, after this report is done, are we
They were pretty much there. All the resolutions have been passed. This was only, anything else that there's Ray.
Madam Chairman,
Yes, Tim.
that was interesting about our veterans population and the energy costs, and we should make sure that we notify that she can get out an email maybe to our veterans in the county.
I'm back.
Okay.
I called in.
Yeah, Tim was just saying about, making sure
We
that
Right. We invited them to the meeting on
Great.
Wednesday, the
Great.
veterans people, so we can do that outreach, because I think what we want to do. So anyways, the plan is to strategize here locally, how we're going to promote this information, how are we going to, all the different ways that you would put this out, providers helping us, websites, press releases, all that sort of stuff. But yeah, so we invited the folks from the Veterans Office to come in, because we can hopefully count on them to, be able to,
reach out.
go out, identify some of the people. We're reaching out to landlords, we're talking to the courts that have the eviction stuff going on. So there's going to be a fairly big lift in a very tight time frame, but I mean, it would be nice to sort of blunt the edge of the evictions that are bubbling out there. Like, we got a list from the Auburn Housing Authority. I asked Stephanie for the people that were in arrears, and there's quite a few people, and it rained. I mean, it'll whatever. I mean, that's kind of what that is, and it sort of jumped on us, and I'd be able to give you a better sense of it. You'll probably read about it in some sort of way related to the outreach before I talk to you guys again. My guess would be I expect that we'll be moving fairly quickly on this.
When's the moratorium on eviction lifted? Do you know, Ray?
May 1st.
May 1st is the deadline? And
Yeah,
this,
it's got extended. Like, it's weird. Like, it's so hard to figure out what it is, right? So it's like May 1st here, and then maybe it's for people who are homeowners who have federally qualified, mortgages, and that's different for them. And I think the thing that's different about this money is it doesn't have to be an eviction proceeding. At least that's not. They didn't say that there had to be. The other money, there has to be some notice of eviction. That all stuff has to happen, which causes us not to be able to release the money because there isn't any eviction proceedings that are happening. So, and now it's gone on for so long that the arrears are longer than 4 months, because it's been longer than 4 months. So now it really has to be a year to go back to the beginning of the COVID. There has to be some COVID related reason for the individual, so the eligibility and all of that and the payment is all going to be done by the state. It's not the local district. What we're going to end up having to do is answer a lot of questions. We're probably going to get a lot more traffic, people coming in, because that's where folks are going to come in to talk, and want to make sure we have some capacity to help them do the applications, both at our joint and want to set up hopefully some satellite locations where people can get assistance and all that. Because, and anyways, just to mention Mr. Foley's question about, I'm the only person here at County Mental Health, and I just got kicked off. So that's why we have the IT upgrade coming along. So I'll give you guys more information. But I think, like to Tim's point, yeah, we're going to try to get all the help that we can to rally up the folks that are in the priority populations, because this money can last. I mean, it can all be gone in who knows how long. I mean, depending on how good counties are pushing people into it, we want to make sure our Cayuga County residents and the landlords get their fair share of relief.
right, yep. Other questions for Ray?
I have just one more. Ray, in your report, you talk about forming the opioid overdose task force, and there's kind of a workflow where it talks about, the county clinic is admitting patients and treating the use disorder, and then you're trying to work with Farnham and Chad on a SAMHSA grant to open a possible treatment program. So what does that kind of look like for you, and what does it mean for our clinic, or what type of program would it look like?
So, I mean, there's a lot of levers, I think, that we're trying to push or pull, whatever, push. You know, the numbers, the opioid overdose. So we, you know, the resources that the Healing Communities grant has provided to the county, both in terms of, you know, staff and also, you know, funding, has really allowed us to shine a light on this particular problem. And getting real-time data is pretty important. So the numbers continue to be frightening, the number of overdoses and the number of deaths. I mean, opiate overdoses, but all kinds of overdoses. I mean, there's a bunch of other stuff happening as well too. But these are the ones that people die from. So I think that, you know, there's been this challenge in the community here to get access to medication treatment for opioid use disorders. There's a reluctance on the part of the providers. There's the philosophy that sort of I take the position and science takes the position that it's outdated. So we tried to move that along. We didn't have much success. So we ended up having to step in here at the clinic. So we're probably got about 14, 15 patients now that we're prescribing buprenorphine to, and they take a lot of time and a lot of attention. And we're really happy to do it. People are, you know, showing up here because they've seen the press or they've been talking to people. So that's kind of exciting. Farnham is an outpatient operation, you know, much like Chad. It's an Article 32. They're based in Oswego County. They just recently merged with, I forget the name of the agency that they merged with up there in the North Country. You know, Eric Brzee is a good guy, somebody I've known for a while, I know his work, and put him in touch with Kevin Harris, who's retiring at the end of the year at Chad. So had them talking about some sort of, you know, relationship where they can, you know, sort of shore up the organization and help them sort of navigate what are really difficult waters to navigate for clinics, particularly OASIS clinics. So there's this opportunity with SAMHSA funding. It's a 1-year startup amount of money for you know, opiate treatment program, which would be, you know, there's 3 approved medications for opiate use disorder. It's, you know, Suboxone, buprenorphine, methadone, and Vivitrol. We don't have any access to methadone here in Cayuga County, but we probably have, I don't know, 30 to 40 residents that either drive to Syracuse every day or take a Central bus to Syracuse every day to get their dose, and come back. They do that 6 days a week, then they go to work. So there's people who fail on buprenorphine who, you know, might have had a few tries and it didn't work for them, and, you know, they're looking for. I mean, we actually had a patient come in here on Friday that Shalaya saw that was looking to be inducted in buprenorphine, and turns out that patient wanted, you know, methadone, so we arranged for them to get transported to a methadone clinic and get them inducted there. So that's how it all interrelates. And the part about the, you know, an opiate overdose, you know, sort of task force is a thing that's happened in other counties. That there's a bunch of different models for this. I think we think, it's not just me thinking this, it's the folks and is part of the healing communities and all that. So this needs to be, this is a public health problem here in the county. I mean, I've probably taken 7 or 8 kids into foster care over the past 4 or 5 weeks that the families were, you know, so opioid involved, you know, that they weren't able to keep their kids safe. And you know, you got people, you know, 4 or 5, 6 overdoses. One day we had 8. I just think we need to have this sustained focus and attention on this problem, and, you know, what we're going to do as a community. We want to marshal our resources. We want to continue to collect data. We want to analyze it effectively, and then we want to deploy whatever it is that we have to do to you know, to keep people alive, and you know, give them a shot at you know, recovery and, you know, living their best lives. So it's sort of all, I guess what I mean by levers is like all these big problems, whatever they are. It would be nice if just one thing worked, but it never does seem to be that way, right? So we want to make sure we pull in all the levers. And I also feel like, I mean, these are things I'd like to get done before I leave. I don't want to leave this for the next person. This is we probably should have done it years ago, but we didn't have the bandwidth, and I think we're paying for that now. So.
And Ray, if I understood you correctly, there is kind of a standard of care that these opportunities are afforded to people, right?
Yes, it's our obligation by regulation, but I also think it's a moral obligation keep people alive.
Yeah.
It's an interesting argument that and discussion that's happening in the community, about this. But I mean, it's
Yeah.
just one of those things that just needs to get done. I mean, if we waited to line everybody up, we'd have another 50 people dead.
Yeah. Okay.
We just had a couple more die the past week. I mean, that's awful.
Mm-hmm.
Burying your kids. So I just want to mention a little bit about,
Okay, go ahead.
just because you should know this, we are getting slammed here at the clinic and at the Department of Social Services. Here at the clinic, it's been going on for a while now. Cases are just like people that we've never seen before, never had any reasons, to seek mental health treatment. The therapist caseloads are up to around 150. The prescribers, full-time prescribers, seeing between 350, 400 people, and becomes an issue. So I just wanted you to know that.
Ray,
And
do you
over at the County Mental Health is Child Welfare and Adult Protective Services, same thing. This has been an awful long time for people to live in a pressure cooker of isolation and, the typical supports that they would have in their lives, like in-person school and going to movies and all that sort of stuff. It's really starting to weigh on the community, and it's leaking through, and those departments are really bearing the brunt of it, I think.
do you know if the other agencies in the community are seeing similar issues? Does that come out at Community Services Board or anything, or? the other
Some of
sec-
the agencies, they don't show up to report, but my guess would be, I don't see why it would just be us. I think people, it's much easier to get into this clinic, and I think that's pretty well known in the community. So we see patients here that across the entire economic sort of spectrum that I don't think county clinics typically see. I mean, we see the chronically mentally ill and all of that sort of stuff, but we see a lot of upper middle class people, professional people, and their parents and their kids, and it's just they just do a good job here. So it's just so easy to get in, and you can see a psychiatrist, same day if you need to, and I think that's really rare, and I want to preserve that, which makes me the last bullet on this thing. I mean, these two departments cover an awful lot of costs for the county. A couple $100,000 in security. It's going to bring us about $45,000 over budget. A lot of departments, so jail services, IT, all these expenses that we took on trying to be helpful hasn't been very helpful to us. And maybe they ought to be realigned with where they belong, so the county can get a true sense about what department costs are. I mean, that's a lot of money it's almost $600,000 in county expenses that we claim in the departments, and it becomes difficult for us to go get the resources we need, because just using the building security as an example, if we weren't covering all of that, I mean, that's 4 child protective foster care workers and 3 additional adult protective service workers at no extra cost to the Department of Social Services. So I think that's a discussion I'd like. You guys are talking about you're talking about a finance department, which is a conversation I think I tried having 5 or 6 years ago with a chairman who didn't want to have the discussion. But I think you want to line up all these expenses where they belong, so you guys can get a true sense of what departments cost and what the services cost. So hopefully I can provide you guys some more information about that over the next couple of months.
I think, again, part of the strategy had to do with maximizing state and federal reimbursement for the county overall. But you're making the point that there's still a small, even if it's 75% reimbursed, local share that shows up in your prospective budgets. Is that?
I think we're feeling. I mean, I myself, and I know the folks in the management teams are sort of feeling like, that it's nice that we're helping, but it seems to be interfering sometimes with us getting the resources that we need, and we see what happens, with other departments that benefit from this arrangement, but we don't seem to get a benefit. So I think that's a little frustrating, and that's part of what drives it too. But I think I would like to make sure that, just for an example, every year, right, I gotta get the strangest bunch of questions from legislators, just a couple, 3 of them, about the County Mental Health Center and its financial viability and all that sort of stuff, which gets a little redundant. And it's very confusing for people to understand. So maybe if the $225,000 of services that we're paying for other departments to cover their costs, maybe if that was an in our budget, it might be a little bit easier for folks to understand about the fiscal viability of it. So that's sort of part of what's underneath it as well too. It's like every year coming up and having that discussion and not having it get anywhere. And then I worry about who comes after me. Are they going to be able to sort of understand the politics of it and what drives those kind of discussions and be able to defend a department that's probably one of the highest functioning clinics in the state. And I mean, that's all. I mean, I don't really want to, I just wanted to put it on your guys' radar that I think it's a conversation that's worth having, because I don't think it's sustainable for the two departments to pick up $500,000-$600,000 of other costs without the legislature fully understanding and appreciating what the impact and the value is to taxpayers. And I think that's a conversation worth having.
Well, and
We can.
we can certainly have that conversation, but I mean, you had made the recommendation that the county pull in some of those jail costs for the overall benefit of the county. And that's
Right.
kind of what happened in the budget. And
I know. It's definitely a sin of mine for sure. In retrospect, I don't think it was for the reasons I did it, didn't turn out to be necessary, I guess.
yes, to be,
You know, just being honest with you all. Yeah, definitely, for sure. So yeah, we can talk about it.
Elaine,
yep.
sorry, Heidi has a question that she sent through chat, and then
Who does?
I can't see them. Yeah,
Heidi?
I can't see those.
Okay.
need me to read that to you?
Yes.
Okay, hold
You
on.
could read them to me. I'm on the phone now.
It just says, can someone tell Ray I would like to talk with him about other harm reduction program possibilities like fentanyl testing strips for users?
Hold it. Can you go back to can you start again, please? Because it was garbled coming across.
Yeah, it just says, can someone tell Ray that I would like to talk with him about some other harm reduction program possibilities like fentanyl testing strips for users and other unique harm reduction techniques like being used in the Rhode Island program. That was from Heidi. She just wants to talk to you at some point.
Give me a call. Yeah, definitely. Give me a call, Heidi. We'd be happy to hear that. I think we're familiar with the testing strips, and I think we're researching a needle exchange program right now, or we've hired somebody to do this for us. So again, all the different levels or all the different levers. I mean, I think we got to put them all in play. And I think that has been, I think those strips have been very helpful keeping people from dying, because they can, so I don't know if you got, so what they are for those of you who don't know, that you can, if you buy a drug, you can use the strip to let you know if there's fentanyl in it. And fentanyl is typically the thing that kills people, because its potency is just, you know, so many tens of, sometimes 100 times greater than heroin. So we're interested in any ideas anybody has. Send them along.
And then Elaine, I had one just for Ray. Is
Here,
it
go
possible
ahead.
to have him send us some type of spreadsheet that has those costs that he considers that should be realigned to other departments?
Sure.
And we can kind of see, you know, what they're referring to and where he thinks they should be. You know, I think that would be helpful.
I mean, yes, okay. I mean, we did talk about the sheriff taking, all right, that's fine, Ryan, that would be great. Okay,
Do whatever you ask.
anything else?
The question.
Okay, Trish.
Yep. Hey, Ray.
Hey,
I was just wondering, with that housing money that you just learned about, the 58 million for upstate,
yeah, don't quote me on the 58. I'm just trying to remember that. It might be more.
oh, okay. All the applications are going through the state, you said? So
The state built a portal.
are they looking at like sustainability moving forward? Like in terms of they're paying a year's worth of rent arrears? Are they looking at whether or not the unit is going to continue to be affordable for somebody? Is there any money for relocation if somebody's financial situation has changed and they can't afford the apartment that they're in currently?
We don't know. I think that those questions were raised on the call by commissioners and other folks as well, and they really didn't have that information. So they're going to, through the portal, through this application process, they're going to determine people's eligibility. So I think when the money's gone, the money's gone. From a sustainability perspective, I think then what'll happen is, unless more money becomes available, it'll go back to, the traditional sort of resources that we had, which is, using DSS funds or, STEP money or something like that. I would hope that there would be a way for them to understand it doesn't do anyone any good to do, right? And which you get, so if you pay the arrears for somebody and you paid their 3 months rent ahead, if that's where it landed, but they were in unaffordable housing, then you're right, that really didn't help. So I'm not sure, we don't know any of those kind of specifics, how that's going to work. I'm not sure. I don't know. It's hard to tell like how much nuance when you stand something up this quickly, you know what I mean, right? There's going to be some stuff that's going to get missed. So they were going to get back to us on all of that stuff, because those are the exact questions that folks were raising.
And will individuals then be able to go directly through the portal themselves to seek funding, or will they have to go through like a partner agency?
Both. I think we want to set it up so that, I mean, obviously folks can go into the portal themselves if they're able to. There'll be a bunch of folks who can navigate that system. And landlords can go in and begin some of the stuff as well too, and work with their tenants as well. So we want to market and educate the landlords about being helpful too. It's like going to Tim's point. It's like having the veterans office help us identify the veterans, have the landlords identify the tenants, and then I think we want to have some capacity, with some partners. I think about like Gary, right, at the Rescue Mission, and Stephanie over at Auburn Housing, and Crystal, and then we have CAP, and places that typically are running across folks who are jammed up that way. We're going to get some money from OTDA. We don't know yet how much, but there'll be some money for subcontracting some of that stuff. So we want to do that as often as possible. I think maybe there's an opportunity too with, like, I know Kathleen, those guys have had great success working with the towns and villages as well. You know what I mean? With the vaccinations, there might be room for them. I mean, the thing is, we have to do this. We have to like 3 weeks to stand it all up, and 3-4 weeks to make it work and all of that sort of stuff. So I think we'll try and hit as many levers as we can.
Well, you'll have your work cut out for you. Thank
We
you.
love getting more work. This is helpful though. I think again, like it expands the eligibility for folks, and I think that's important. It's somebody who's working full time at Walmart, becomes eligible now, as opposed to they weren't before, kind of thing. You know what I mean? Last thing I want to tell you, we have the Touching Psychiatric Center and OTDA is going to be coming here to do a mobile clinic for homeless people with the shelters, and want to move folks in, from the motels. And they got the J&J shot, that 1-dose shot. That's the perfect population to sort of vaccinate, because you never know where they're going to be in 4 weeks, and you might lose them. So that's a pretty high risk population. They move around a lot, and we have about 70 folks that are homeless today. So try and get as many of those folks vaccinated as we can. That's sort of my report, but I'm happy to answer any more questions if you have them.
I'm sorry, Ray, how are you working to get them vaccinated, which is a great idea, transporting them?
So Hutchings, like they use the psych centers in the state have become these these vaccination hubs. So they have some mobile capacity. They've got they're not Winnebagos, but they're like that. These were the things that Helio Health did for mobile oral substance abuse treatment, stuff like that. So what they do is, you know, they're gonna come here to Cayuga County, and they're gonna come with, you know, the typical sort of clinic sort of setup that you have now. You're gonna have so many doses, you know, how many J&J doses we're gonna have, and we'll work on our end, you know, so they need space, so we'll, you know, find them space. They can do it here at the clinic. I think there's some spots up at the Ray of Light shelter, and, you know, so, and then we'll set, you know, we'll organize it, we'll set it up, we'll have the shelter be ready to transport people. Either they might go to Chapel House, they might go to the Ray of Light. I got the call Wednesday at 11 o'clock, I think. And then, you know, I don't want them going to motels and parking out there and vaccinating people in the motels. I have enough problems with the landlords. We had the motel, and one guy got assaulted a couple weeks ago, a bunch of damages. I don't think they'll be happy with that setup. And so we'll probably get those folks transported to another site, maybe here or one of the shelters, and we'll sort of do it like Chapel House can do some transport. We can do some transport. So it'll just be like a logistics thing, right?
Yep.
The date, the times, how many slots there are, and it'll be up to us to sort of push the people into them.
Good. That's great.
Yeah, I'm excited.
Very. That's great. Okay,
I'm
any,
excited about shots. How funny, right?
yeah, you better believe it. Anything else for Ray? Okay. All right. Thank you.
All right, you guys take care. Have a nice night. We'll talk to you next month, I guess, right?
You too, Ray.
See ya.
Madam, motion to adjourn.
I'll second it.
Okay. All in favor? Are we doing all in favor?
All in favor?
Aye.
Okay, aye. Bye.
All right.
Good night.
Everyone, have a great night.
You too.
We'll see you guys tomorrow night. Is that what's happening?
I will be here tomorrow.
Yes. Okay.